Starting. Hi, good morning, Regine. Thank you for accepting our request for a second interview. My name is Ann Chow. I'm the manager of the Houston Asian American Archive. Today is January 19th, 2022. And this is a follow-up interview from your initial interview in 2012, exactly 10 years ago. Since then, you've done so much, and we are very interested in practically everything. We're interested in everything you do, but in particular, your work with the Asian American Health Alliance, in particular with Hope Clinic, and then your experience with the Asian American Family Services. And also, when we also would like to know more about the awards you received. You have received so many awards from, I think, 1990 all the way to 2020. The latest award is the Random Acts of Kindness Humanitarian Award. And in 2017, you received a Robert Woods Johnson Foundation Asian Pacific Islander Caucus Health Equity Award. If you can tell us a little bit more about that, and also in your professional life, that you do so much for the community, we forget you actually have a real professional life. And we'd like you to talk a little bit about that as well. So thank you so much again. Would you like to start with the Asian American Family Services and your experience with trying to provide mental health services for the community?
Thank you, Ann. It's a joy to be back with you. I can't believe 10 years has passed already. We haven't changed at all, have we? This is an interesting story in my life because it was about mid-1990s, and I had taken a break from my job, my full-time jobs. I, as a mother and a woman, you can I think relate to this. So right after college, I started working. We had children somewhat late in our married life, but had two children. I went back to work. I was very fortunate that I worked for United Way at the time with both of them, actually. And I was able to take 3 months off, which was more than, was very, very good for me. And to be with them. And then I went back to work, and I continued to work full time until they were in grade school. And I found that at that age, they were too old to go to daycare and too young to be at home by themselves. So it was a kind of a good time and excuse to actually take a break from working with somebody. So I did. I stopped working and stayed at home more. And what that allowed me to do is actually look at the landscape to see what was going on. I never stopped being active in the community, but I, didn't have a 8 to 5, whatever job, regular job to have to report to. That is when Houston was experiencing a major growth, as you probably know, in our demographic numbers with the APA. I'm going to shorten it, Asian American Pacific Islander, APA community. And we were seeing, the Chinese community growing because the quotas had increased. The Vietnamese, of course, by that time, 2 or 3 waves of Vietnamese refugees had come to Houston and made their home here. And so in the mid-90s, we started to see our AAPI community grow larger and also being more diverse. Before, when I would see an Asian face, it was usually Chinese. And at that time, when I was growing up, it was usually Chinese from the southern part of China that came here, Guangdong or Canton area, from the villages, and you've done all of great history about some of our families here. So we all knew each other. We didn't live close to each other. We didn't have a major Chinatown. We had a business Chinatown, but not residential. But we all went to different schools. And so we had certain organizations that kind of pulled us together. So a couple of colleagues and I got together, and at that point, we decided to start the Asian American Health Coalition. So it's AAHC, because we saw a need for healthcare. At the same time, some other colleagues of mine and I were into mental health, and we decided we needed to put some time into starting an Asian American mental health organization. The Asian American Family Counseling Service is what we called it. And so it's just kind of coincidental that they both started at the same time, 1996. And again, because I was not, with a full-time job, I was able to put some time into it. It took several years for both of these organizations, and we can talk about the Health Coalition later, but the Family Counseling Service, it took us a little time to get that going. I had the benefit of 3 friends who were in the field professionally. Dr. Monique Chung, who you probably know, she's still at the University of Houston. Her husband and colleague, Dr. Patrick Leong, also at the University of Houston. And when they both came from the Denver area, I believe, they just quickly made a home here, and they have been at the University of Houston Graduate School of Social Work since that time and have really built a lot there. The third is a woman who was in private practice, and unfortunately she's passed away now, but the benefit and knowledge and all of their wealth of contacts and just knowing what we need to do, we slowly built the Asian American Family Counseling Service. At first, as all small emerging groups, we had to get some funds, and we were lucky that Houston Endowment knew some of us and entrusted us with some funding, and that got us started. So we started with the resource database. We hired a part-time person to do a little bit of referral, and that's how we kind of, started growing. After about 5 or 6 years, or maybe less than that, my time now escapes me, but a good friend of mine who had left Houston and decided to come back. When she came back, this is Kim Cito, she took over as the executive director full-time. And she was able to really grow the organization a lot and brought in professionals, mental health professionals, to serve the community. And it thrived for a good 12, 15 years. Unfortunately, her health was not good, so she had to retire. And it's so hard for anybody to get mental health funding. And at that time, which I think would have been it's been at least 10 years since she's retired. It was really hard. It may be a little bit easier now, I don't know. Funding in general is hard, but for mental health, it was difficult. And in the Asian American community, as you know, we have the double challenge of language and culture. And mental health, in terms of Asian American population, is even more, I think, challenging than physical health even. Physical health is certainly understood. You go to a doctor to fix whatever ails you, but mental health is elusive. I mean, in the Eastern philosophy, Asian community, we kind of have holistic medicine. I mean, we think of mental, physical, we don't segregate it. And we certainly don't go to a stranger and tell them all of the problems we're having, even if they could speak our language, which very few of them could at that time. So it was a hard hill to climb. And we really appreciate all the work that Kim and her staff did. And it really was a good opportunity, but it just didn't sustain. So unfortunately, in the, I'd say the early 2000s, let's see, what are we in 2020? So probably about 2010, it closed. So this is where Asian American Health Coalition Hope Clinic steps in. Hope Clinic, as you know, is a federally qualified health center. As an FQHC, we are required to either refer to or provide mental health, we call it behavioral health services. And we have begun to do that. And of course, physically, the two organizations for a while were very close in proximity to one another. So we were hoping to do more referral to the Asian American Family Counseling Center as our referral source. Unfortunately, when it closed, then we were really without very many referrals, places to refer to. So that really encouraged us and forced us to build our capacity more. And finally, today we have a pretty good behavioral health department. But the challenge is with both Asian American Family Services and the Hope Clinic is finding the staff, because you've got to find staff that are bilingual, bicultural, and have that expertise. And we could find some, but it's been very hard. That's the challenge. So AAFS, in the time that Kim was the executive director and in its heyday, I guess you'd say, it changed its name to the Asian American Family Services and took on more of a broader family service type organization. They didn't just do counseling. In addition to counseling, they started getting into job training, and some other family referrals and case management, and they work with youth a lot. They actually went into the schools and they would have teams of youth that would meet in a support group setting. So they branched out, and it was really good, and they did a lot of education and outreach. But again, the funding was not there to sustain it.
Oh, great. Thank you for this very good detailed rundown. I just have a few follow-up questions. What led you to start an Asian American Health Coalition? What were some of the reasons you wanted to start that?
So it actually was triggered by a mental health. And now that you bring it all back in full circle, there was a Southeast Regional Mental Health Summit for Asian Americans in Houston. And again, my colleague, Dr. Beverly Gore, Lynn Nguyen, who at that time was working with the United Way. Beverly is a dietitian by profession, and she was working full time, I think, with the city of Houston. But anyway, the two of them they actually attended the summit. And one of the recommendations out of that summit was that we needed a healthcare resource for Asian Americans. We had nothing at that time, and it had to be culturally and linguistically competent, because that was one of the big problems, is the fact that there was just no resource like that in Houston, but yet our population was growing. I also had the benefit of going to some other cities like Denver, Boston, and seeing their Asian community with resources that we were trying to emulate here. And yet they had fewer Asian Americans. I mean, our numbers were bigger than theirs. So we said, we got to get on this train. And that's what prompted it. First of all, was the summit that actually identified the need. And some people that attended that summit started to convene, and we started holding meetings to talk about what do we need to do. And so that was the main thing, is triggering it, but also the people that were working here that saw the need. And so, Anne, I think the big story was, once we all said, okay, we have this need and we need to start these services, we started to go out, and some of us had some experience and knowledge of, starting up services and programs. We had, again, Lynn with United Way, which was a big ally at the time. And then I've had experience writing grants and trying to get funding, and Beverly as well. But nobody believed us. Nobody thought that the Asian American community needed services. And that because of partly the model minority myth. You guys, have what you need. You're smart, you're talented, you're resourceful, and we don't see you out there. We don't see you asking for services in the public sector. Well, the fact is there were people asking for services, and there were nightmare stories. One that I always remember is the woman who went to the Harris County Hospital District at the time that had the Gold Card, the programs for low income folks. And she sat all day waiting to be called and to find out that they had called her name. But because people were not fluent, in their language or knowledgeable at that time about these foreign names and all, they mispronounced it probably terribly. And then of course her knowledge of English was not good. So she didn't hear it. And she didn't know to get up and ask. That takes a little courage as well. So all in all, she sat there all day waiting to be called. Nobody checked up on her. So there were few people that did go out for services, but their experience was so horrible, they never did it again. And so it was like catch-22. We weren't out there asking for services, so people didn't think we needed services. So, and Stephen Kleinberg, our dear Dr. Kleinberg, about 1998, I think it was, or 2001, maybe it was even as late as that, the community leaders talked him into doing an Asian survey, much like what he does for this county and the city of Houston, and had done by that time many years. We had to raise our own money. I'm sure you helped us. And we did the first Asian study. I want to say it was 1998 at that time. We've only done 3 since then. We wanted him to help us do a 4th before he retires, so we'll see. But anyway, he did that first study, and as we found out from the data, and that was like the first study of the Asian American community in Houston. When we wrote grants or wrote case studies and things, we'd have to take data from other cities, San Francisco, New York, Boston, other cities that have had Asian communities and kept data. And we would have to, extrapolate to us and say, well, this is in San Francisco, but it shows, that, and our population is probably not much different. Well, there's nothing better than, homegrown data. He, even though his survey was more generic, it did come out with data that we could use. One major thing was 3 out of every 4 adult Asian American in Houston, or Harris County at the time, was foreign born and first generation. And so that's a high number, 75%, which really documented the need for language and culture, linguistic and cultural competency. And so we were able to use some of his data to start to paint a picture of Houston. And with that, and also our advocacy that we did, the Asian American Health Coalition as a group, we finally got a grant. And slowly but surely, we started to, bring on people that could work in the area. And then in 2002, so it took 6 to 7 years for us to put our toe into the healthcare business. We were more in education, outreach, advocacy, research, community outreach type of organization at first, because all of us were volunteers. And then when we hired our first staff person, it was Karen So, who we call one of our godmothers as well. She was able to organize a 4-hour a month clinic that we had at the Chinese Community Center, because they donated space the last Tuesday of the month. And we had volunteer doctors and other volunteers from the Chinese Baptist Church that would come, and they'd set up kind of a little, pop-up clinic, 4 hours a month, the last Tuesday of the month. They charge $5 per visit, just because we knew that people would value more something that was, a little bit of funding on their part, but not to inhibit them from getting services. And of course, we did a lot of referral, but the docs that could see them and advise them, did that. That's how we operated for a couple of years. In 2005, 2 or 3 years later, Katrina hit. And you've probably heard this story. We were invited by the Boat People SOS, who had an office at the Hong Kong City Mall. And that's where we set up shop to help the thousands of Vietnamese refugees, or evacuees, I should say, that came from the Louisiana Gulf Coast. The Vietnamese radio would tell them to come. They would have shelter because it was an enclosed mall and they were allowed to stay there. And then there were food services there, so, you know, they could get food. But thousands of people came over a course of several weeks, and Hope Clinic provided the medical care and visits that they needed. So eventually we moved back to our offices, which were still at the Chinese Community Center. We had outgrown the original, you know, I call it one room schoolhouse type of thing. And we actually had offices, a couple of exam rooms that we paid for it all. And we started to ramp up our hours. We were opening 20 hours a week and eventually 30 hours a week. We had a part-time executive director we hired. And like I said, it took a few years, but we finally ramped up. In about 20, I don't have exact, and so I can find out. I need to do a little bit more digging, but my recollection is in about 2007, we hired our now current CEO, Dr. Andrea Karakostas. And Dr. Karakostas had for us expertise and experience in working in FQHC business. It wasn't a clinic that she worked in immigrant or migrant farm workers network, which wasn't FQHC. So she knew a lot about how they operate, what they was expecting. But her experience working in a, you know, stone and what do you call it, brick and mortar type of clinic was not there, but she was very good, very smart. The other thing we did, and the Beverly, Lynn, and I kind of, and Karen kind of worked it together. We were, when we were hiring for an executive director, we always felt like, you know, it's an Asian American outreach. We need an Asian American, you know, staff. But we found out that it was more important that the staff have a heart that was akin to community health. And that was more important, we found, than what you look like or what your background was. Not that you can have that. You need to have certainly a heart for different people and who they are and what they represent and how to work with them. But you didn't have to be of their background. And we learned a lot in the process because we stayed up many, many hours when we were trying to hire for this position. We went through 2 or 3 people over time, and that's how we learned these lessons. And Dr. Karakostas, to her credit, you know, has really proven that. Under her leadership, we were able to then, in about 2008, I want to say, become an FQHC lookalike. So FQHC is not an easy thing to be. And if you know Houston, we probably have about a dozen. And for a city our size, that is just crazy. You go to somewhere like Chicago, Boston, other cities like that, they have, I think Chicago had in the hundreds because they started earlier. And I think Houston and Texas has this attitude that, you know, as long as we can do it ourselves, we will. We don't want any outside intervention or funding if we don't need it. So for a long time, we really fought that. Under Governor Bush, George Bush, when he was in office, he really pushed it. He really started that whole effort to get more FQHCs into our state. And he started an incubation program under the state that we were able to tap into. And actually, we eventually hired the woman that ran that as our executive director early on. And she helped us really get ready to be an FQHC. When the co-founders, Beverly, Lynn, myself, you know, when we got together early on to design this or to envision it, we wanted to be an FQHC from day one. And that helped a lot, because if you don't structure yourself early on and you kind of convert to it, it's a little harder. because the guidelines and the requirements are so stringent. One good example is we have a great community nonprofit clinic here in Houston. I'm not going to name it, but it has aspired to be an FQHC. But because of its origin, a foundation started it. It's tied to this foundation and its, its founders and all. It's been hard for it to convert because it would have to change its board entirely. And the governing board has a lot to do, of course, with the history and all of the organization. So I think that was to our benefit, that we always wanted to be an FQHC. So in 2008, we were a lookalike. That meant that we met all of the requirements the government asked of us, but they had no money to give us. Because when you become an FQHC, one of many benefits is you get a grant from the federal government. It starts at about $650,000 a year. Seems like a lot, but you're expected to use that money to serve the underserved, the people that cannot afford services, because you are the safety net. And so you've got to document how much you're spending, how much things cost. You've got to create your own unit of cost, and it's got to conform with what they're requiring. So, it took a lot of that to do that, especially when you're starting up, keeping those records, knowing how to report it. So it really helped to have this woman who understood FQHCs to be at the helm for a while. And then, of course, like I said, Andrea, Dr. Karakostas joined us, and with her knowledge, we were able to become a lookalike. And we stayed a lookalike for at least 3 or 4 years until the federal government had the funds to create the grants. And we were finally chosen to be an FQHC. So it starts out at $650,000 a year for this grant they give you, with certain expectations, and the reporting, of course, is very precise and all. It grows each year or each time if you do well and you show that you're complying and you're meeting their outcomes and all. It grows. I think we are maybe up to 2 million now. So that has been a wonderful accomplishment. In addition, being an FQHC, they underwrite the malpractice insurance that doctors need. And that could take a big bite out of your budget if you have to pay out of your pocket. So that takes up a big expense. They also allow us to get drugs or pharmaceuticals at a lower price. There are a lot of advantages. We also get kind of I don't want to say an incentive, but it is like a reward for doing well. So if you show good outcomes, then you get some additional funding. And our doctors and providers have all, done well there. So I think we would, we really do very well. We've won some awards and stuff, honorariums and things like that for being a good performer. So being an FQHC was important. So that was a major milestone in about 2012, I'm going to say. Along the way, in Hope Clinic expanded. We had a new location. Our original is in the heart of what we call Asia Town in Houston. We have that location. It's called Hope Main. We opened one further down Bel Air Boulevard, which is the corridor going west toward Highway 6. We call that Hope A-Leaf, because the growth of Asia Town and the Asian Pacific American community was growing, more and more that direction. Then we opened another location in Westheimer, which we call Hope West. And that was something we had to do because we actually had an office in that area, but it wasn't a standalone kind of a storefront office. It was more in a professional building. Unfortunately, we lost the lease there, and we had purchased a practice from a OBGYN at the time who wanted to kind of retire and step back. And that was a great direction to go as well, because that allowed us to help start delivering babies and then getting them a medical home with their parents and families, so that we kind of built a great client base through that avenue. And Medicaid, of course, was funded a lot of that, so that was a good source of income. Successful FQHCs, and we have lost a couple in Houston, unfortunately, because they couldn't adhere to the guidelines or keep up or whatever. But I would say successful FQHCs have a good balance of funding sources. Even though you get this governmental grant, which is a lot, you can't survive just with that. You've got to have third-party sources of income, insurance, Medicaid, Medicare, other sources, as well as patients paying their own, if possible. And so FQHCs have sliding fee scales so that people with very low incomes pay a little. And if you have higher incomes, you pay more. Actually, you don't have to be low income to go to an FQHC. You could pay the full amount. So our sliding fee scale has gone from, well, we started at probably, $5, $10. I think it's up to $30 now for the low end, all the way up to, whatever the market price is. And again, the government oversees it. So we could not charge an outrageous amount just to make up for some money that we may think we need, make up a deficit or something. It's got to be within a range. So there's a lot of oversight, but you've got to have a good balance of funding sources, and you've got to serve the community's needs. So again, we were in the southwest part of Houston. That's where we initially started, a very diverse part of town. We started as an Asian American organization because that was the need at the time. It has grown into what I call more of an immigrant population. And because Houston has been the home for many immigrants and refugee populations, we've seen the census of our client base now shift more to Hispanic, because a lot of Hispanics live in that area, and then a lot of Hispanics are immigrants that come from other countries. African, because again, Africans have been refugees as well. Middle Eastern, they are probably our newest group of refugees that have come. And refugees tend to live in that southwest part of town because it has a lot of multi-family housing, and it's inexpensive, or at least, affordable. So we attract a lot of different populations there. So our clinic, I have to say, our claim to fame, our niche has been serving the immigrant refugee population, which requires staffing that speak different languages. And that again continues to be, a challenge, but one that we are very proud to meet. Our staff speak, 30 or more. The total staff speak a total of 30 or more languages and dialects. So just finding people from the community is important. That's how you find them, is you hire from the community. So that's another thing that Asian American Health Coalition Hope Clinic does, is they hire from within. So we really are an economic engine for the community, bringing on staff, and a clinic staff is variety of people. It doesn't just have to be medical background. You need people doing IT and, janitorial services and just all kinds. Of course, our newest milestone, and you know this very well, is our new building that we hope will open in 2023, at the end of 2023. I have to say that when I got back on the board, I think back in 2010, 2011, one of the things that I wanted to take up was looking for a permanent home for us. We, lease and rent different spaces, and that's fine. but it's always like we have to make it force fit it to work for us. And then we're at the mercy of the landlord or whoever. We said, it's time. We're here to stay. We're going to be in this part of the city. They need us. We've been apart for all these years. It's time to kind of put a stake in the ground. So in 2011, we started looking, I say we, the board gave us permission to start looking at what would work for Hope Clinic. Should we rent, I mean, not rent, should we buy a building already existing and remodel it? We looked into that. Should we partner with somebody else that has an existing building that maybe we could come together and do something? We kind of looked into that. It took a couple of years. Remember, we're all volunteers because we created a building committee that took this on. And we finally decided we would purchase property, and we knew, and then where. So that took time to assess, where do we want to be? Well, we decided that part of town is where we want to be. Bel Air Boulevard is the corridor through the Asiatown area. And it was, we say Asiatown because the Vietnamese community started to move in there at the early part of 2000, and they were building businesses. Filipino, you know, a lot of Asian businesses were being located there. Also other non-Asian. So we decided that was a good move. We found property on Bel Air. It took a while. All of that takes a long time, as we found out. Finally, we decided that we would create a building there, 3-story. It started out as 80,000 as we got working on it and started the capital campaign, and reality set in. It got down to 70,000, which is still a big building. And to this day, you know, that's what we're going to be building. And we broke ground in October, late October, and you were part of that. That's our big thing now. So we look forward to it, and we don't look at it as just a clinic and a building. It's really a center. We hope it will be a beacon for that community. It's growing. It continues to grow, but I think it may begin to, you know, coalesce the community together. There's a lot of good groups there, the A-Leaf Super Neighborhood, a lot of groups we work with, and the International Management District. I think we can all work in concert to really build that part of town up. So we're excited about that. And if you don't mind, I'll just move to what is the next chapter. And actually Andrea, Dr. Karakostas lovingly calls us the godmothers, but the co-founders of Hope Clinic and the Asian American Health Coalition, we continue to be involved. I'm on the board officially. The other 3 are supporters, but the 4 of us have talked, and we really would like to see the Asian American Health Coalition itself. Now, that's the parent of the legal name. Hope Clinic was the name we gave to the clinic. And actually, it's an acronym for helping other people through encouragement. Beverly Gore actually came up with that acronym, HOPE, because she wanted something that reflected a generic type of, we didn't want to be specific to any group of people, even though we started off with AAPI. Now we see that we're very diverse, but HOPE was what, you know, we wanted to give people. So what we'd like to see is sort of going back to our roots. What got us started? Because as I told you, we started in 1996 with the effort to start a healthcare, you know, clinic, but it took us 6 years to get on the map. We relied on community outreach and education, research, advocacy, and also convening and coalition building. Those were the 4 kind of pillars, I call them, that sort of got us to where we are now. And we'd like to go back to those 4 pillars and put more emphasis on them. Now that we've got the clinic side of our operation really going well, hopefully will continue to go well and grow even more. We'd like to see the other facets that brought us sort of there. And that would be those 4 things I mentioned: education, outreach, advocacy, especially advocacy. We want to continue advocating for healthcare, affordable healthcare in general, but also for our community. We still see a lot of needs, disparities within our community. So advocacy is really key. Convening and coalition building. We didn't do this alone. We had other minority health organizations that we work together with, that we would help each other out. And we want to continue bringing our sister agencies, especially in that part of the city, together. I boast a little bit, but I think, Hope Clinic, Asian American Health Coalition has been able to help other Asian organization, nonprofits. Light and Salt comes to mind. They were just a community-based group. They did pastoral counseling because they come from a faith-based background, mainly Chinese. They were Chinese speaking, so they did support groups and all. And through some funding, we would sub-grant Light and Salt and other groups, Boat People SOS, VN Teamwork, other nonprofits, some grants so that they could do some things. They've been able to help grow. So we want to continue coalition building like that, especially in areas that where great need exists, which you mentioned, mental health. That still continues to be a big area. And then research. So the joke used to be when we got started in is Houston would be the pilot. I mean, we wouldn't be the pilot, we'd be the test, whatever you call it. We'd be the control group because we had nothing here. So they would start a program somewhere else and then they compare it to Houston because, we had nothing. So you're comparing something with nothing. We got tired of being the control group all those years. And so now we, want to generate a lot more of our own research. And we have people like Beverly Gore, who has done some research here in Houston and gotten us on the map. But we used to be part of national research projects, and we'd like to do more of that. So the co-founders, if you will, myself included, we'd like to kind of go back to our roots and put more emphasis in terms of funding, staffing, organization behind these 4 pillars and really build it up more so that it is, thought of just as much as the clinic side of our work. And then the other thing we've talked about, but we said we're not going to touch it until we get this building built, is what's called the PACE program. PACE is an acronym for programs, programs of all-inclusive care for the elderly, PACE. And it's a model program that has been funded in all other states in the country. We have a couple of programs in Texas. We applied for a state grant to do PACE about 5 or 6 years ago, maybe even more. And we didn't get chosen, unfortunately. The entity that got chosen was going to start one in Houston. They were going to build a multifamily housing for seniors and then provide the PACE program there. Now, what the PACE program is, it provides comprehensive medical and social services to certain frail elderly people so that they can live in the community. So it really is an alternative to nursing homes, and it's less expensive. It's been shown to be. And it's been shown to be effective because people are, an elderly person who's in PACE would have a team of medical and social professionals. So doctors, nurses, social workers, dietitians, whoever the team is that works with them to keep them from having to go into the hospital or a nursing home, and allows them to stay in their own home longer. And we know from research that seniors that stay in their own home, they do have a better quality of life. They live longer. Most of them do. So PACE is another kind of priority now for us. We'd like to see if we can find some funding, a grant, if the state we'll open up the grant process again and possibly, look into having a PACE program here. Because we've got the health and social team. It's just we'd like we don't want to get into housing, but it would be nice to have a multifamily housing facility that seniors can live in and be served with this PACE program. Anyway, we visited one in San Francisco. That's where it started. It's on lock, and it was really gratifying to see it. Of course, they've grown over the decades. They have a transportation system that buses seniors into a community center type of situation. So you don't necessarily have to live in this facility. You can come in from the outside as well. The thing is it serves it's designed to serve dual eligible seniors. Dual meaning eligible for Medicaid and Medicare. But there is a facet of it I just read where just Medicare recipients could qualify. You have to pay an additional fee that Medicaid would have probably picked up. So, a dual eligible person is going to be low income, and 55 and over is the eligibility age. But because it's been shown to work in the state, even the state of Texas has, desired to have them. We hope that, we can find funding to do that. But that would be another new area to branch out in.
Wonderful. Thank you, Roji. This is such an eloquent narrative, really, of the beginning and now of the future of the health clinic. So we can pivot to some other questions, and it has to do more with you. I think you've been so modest in telling us what happened with the clinic with your group of godmothers, but I'm more interested in your own personal involvement. First of all, I also have another question, is that even though the clinic is growing and is encompassing 30 languages and all the refugee community, there must have been a guiding philosophy behind it. Maybe the four of you had initially some kind of mission statement that you're aiming to serve everyone, and the ways that you displayed your generosity and your humanity by encompassing as many people who need help as possible. So can you tell us a little bit, one, about the philosophy that led to the beginning of this clinic, and then your personal role? Are you the shaper of the directions of the services? Are you helping mostly with the grant writing or of the running of the organization? So,
well, and when we first, I happened to write down, excuse me, our original, the Asian American Health Coalition's mission. Is a nonprofit organization dedicated to improving the health of all Asian Americans in Houston by increasing access to health care. This was written back in 1996, remember? So access to health care and through population-specific health promotion and education projects. It says it was established in 1994. We probably started meeting earlier, and became a 501c3 in 2001. Objectives were to advocate for a linguistically and culturally competent healthcare system. I would say that was a major driving force, because Beverly, Lynn, and I both worked, all of three of us worked in the nonprofit field or public. So I've always worked in nonprofit, not so much in healthcare, but I worked for United Way. That was really Community Welfare Planning Association, which was a planning organization. The United Way, I moved into there. And then I left there to become the executive director of a child abuse prevention organization. But it was primary prevention, and it was trying to prevent child abuse from ever happening before it even happened. So what does that mean? It means educating, right? So it was really educating, using the media and other public avenues to educate people about being good parents. That's what it boils down to prevent child abuse, and also breaking the cycle for those people that were victims of child abuse, for it not to repeat itself. This was way back in the mid 90s, early actually early 90s, before social media. So we really relied on the traditional media at the time, you know, newspapers, TV, radio. So that was a lot of my background. And then after the Child Abuse Prevention Network, I retired. That's when I kind of retired a little bit. But while being at home, I also started up some projects. So I got to put into action the skills and expertise that I acquired over the years working at the CWPA Community Welfare Planning Association, the United Way. And that was to develop programs, to write grants, to collaborate with people, learning, you know, who was out there, how to work together, things like that, and put all those skills together to use. But the three or four of us, again, Karen came a little bit later in our history, but we really felt like our community needed competent services linguistically and culturally, because that's what made it unique from just going to the everyday, you know, healthcare system. The other thing was to provide health promotion, education, information referral. They needed to know where to go, what to do, you know, what were issues, what were problems, how to solve them, you know, that kind of thing. So education and promotion. We needed advocacy. Nobody was speaking on our behalf because, again, the model minority myth, you guys don't need services. Y'all have everything you need. You're very resourceful. But we needed to document and talk about why we needed services. So it was incumbent on us to go to different platforms, to speak in front of groups, City Hall, the hospital district, different boards, different funders, to talk about what our needs were. But we also had to do research and be able to write it down to justify it. So the fourth bullet is sustain a network of Asian American healthcare providers and advocates. Again, bringing us together to work together, but also to encourage and support the work that was going on among our Asian American providers. Maintain a database. We had nothing at the time, so to put that together into a database so that people could use it. And then the last bullet was be inclusive of all Asian American groups. So in the beginning, and we did focus on Asian American. That was the whole purpose, because we had nothing. About, I guess, it was after Andrea came, so, well, it was in the early 2000s, I think. And a couple of us were on the board at the time. 2 or 3 of us were still on the board. And we had to kind of come to a reconciliation of the fact that our population in that area, as an FQHC, we had to serve the people that resided in the area, was not all Asian. So we said, okay, we started out as an Asian American organization. That was our whole focus, as you heard the bullets. But the population is either changing or, you know, it's more diverse. How do we reconcile that? Do we stay the way we are, because there's still a need for Asians, but if we have to, you know, comply with all the regulations and all, we've got to serve the people that we are here to serve. We researched that. We talked to other resources, the Association of Asian Pacific American Community Health Centers, APCHO, in Oakland, the Health Forum in San Francisco. And we found that you could do both. And so it was a mental change for us co-founders, but it was an absolute necessity and a good change, because you must serve the people that you are there to serve and still retain, you know, still retain that niche. So that's what we've been trying to do, still be a resource for the Asian American community in our city, but also to be able to serve. And again, like I said, it's really immigrant refugees. It's people who are new to this country. And that's been a great niche for us. So I don't know if that answered your question, but that's kind of a shift that happened in the course of our evolution, that, you know, it's still something we're balancing and trying to make work. how we operate right now, like I said, what are we? 2002. So we are 20 years into the clinic. I was on the board. Well, Lynn, Beverly, and I started on the board. And then I was president, Lynn was president, and then both Beverly and Lynn have rotated off. I came back on the board, and we have bylaws that say you have to sit out a year at least. And so after a year or two, I came back on the board. That was in 2011, 2010, 2011. And when I came back, I told you my newfound focus was to try to build a building. But the others are not on the board. And again, as a nonprofit, as a FQHC, our board, our governing board is who we take direction from. And they are led by our paid CEO. So as a board member, you know, I can input into what direction. But I have to say, as a co-founder and the other co-founders trying to get input into the system now that has been grown, it has grown. What we have over $20 million budget now, and over 200 employees. So we're humongous. 4 locations, soon to be 5. It's not like we are there every day or any day, really. So finding our niche now is a little bit more challenging, may I say, but we do have some input because of the historical role we played, and Andrea and the board are very open and, you know, usually to hear what we have to say, but there's no formal avenue except to be, you know, on the board, which I think I have another year on my term and then I'll rotate off. But like anything that you have created, trying to shape it along the way, I think we've had pretty good application of that. We've been able to do that through our participation formally and informally. But as it gets bigger and older and all, it probably won't be as easy. So these 2 new avenues I mentioned, trying to go back to the 4 pillars and then maybe look at a new area, PACE. These are things that, you know, I know that the Andrea, certainly as the CEO, has talked about as well. It's just trying to work it in. Yeah. So we want to continue doing that. Now, one of the things that Beverly especially, but I have also helped, and Lynn has also helped. We have kept the coalition part going of the organization. So of course, you know, Hope Clinic it's kind of the tail wagging the dog in a way, but the Asian American Health Coalition is still the legal name, and we still retain the coalition part of our organization. We had held meetings quarterly all last year, and then we've had the health summit. We've had about 5 health summits over the years, and the latest one was last fall. We held it virtually, had to because of COVID. Those are some of the activities we've done. We also communicate and work with our sister minority health coalition groups like the Hispanic Health Coalition, African American Health Coalition. Unfortunately, the American what do we call not the American Indian. Anyway, that coalition has kind of fallen a bit. You know, it depends on leadership and all, and unfortunately, the people involved have moved away. But the Hispanic and the African American coalition still exist. So we try to work with them, especially in this day of health inequities and disparities and racial, you know, hatred and all. When we had the anti-Asian hate, you know, projects and outpouring, our sister coalitions we came up with a statement together that we published just to show support of each other. So we continue to do that kind of thing. But I don't know if that answered your question.
Very much so. Does the coalition have a physical address, or do you just meet on a regular basis somewhere?
So when we were meeting in person, we met at the Hope Clinic. So yeah, so we would get a room there, and you know, we'd hold our meetings, have a speaker. It's a great, because nobody else is doing it. First of all, I mean, when people wonder about Asian American health, they go to Hope Clinic, you know, but all the staff there, many of them are already occupied doing different things. So having this coalition, us involved, is beneficial. And so when people have new projects they're launching, or they want to talk about a thing that they've done, a book they've written, or research project they've just released or something, the coalition is a great platform to do that. So yeah, so we do it virtually now because of COVID. We had a meeting a quarter ago in, I guess, November, on mental health. And it also gives us a chance to showcase our Asian American providers, mental health, physical health, you know, research. It depends. It's a lot of different projects. A couple of researchers from U of H have spoken, and then it's an outlet for them also. If they need subjects, you know, they come and we publicize it and let people know that this is being done, you know, if you'd like to participate.
Is there staff to the coalition?
No, that's what we're wanting. We're wanting, and again, because Andrea is actually the, you know, the head of it, as the CEO of Asian American Health Coalition, the legal entity. We have to work with her. I mean, we work with her, but she doesn't have the time and the bandwidth. I mean, she should. She's busy with the clinic and other things. And so, what we're trying to get the board. We did meet with the board, just to let you know. When I say we, the co-founders, we met with the board. We shared with them our desire to put funding and emphasis and you know, priority into those 4 pillars so we can build them up. So that would require some funding. And we even offered to write grants because we know that there would be some support for that, especially coalition building. And it's just a matter of us getting the green light to go ahead and do that. But we're willing and able to do it, and to build that more up. And so what that would look like, you're probably wondering, well, what does this mean? To me, what it would look like is that organizationally we would have a division or a department, if you will, that does reflect those pillars, you know, not to say we're not doing some of these things. I think we are, and Andrea does say we do some of them, but you know, they're like part of the clinic. We'd like to see them take on a bigger and stronger role and have staffing. So like a director maybe of, I don't want to say public affairs, but external affairs or something that would oversee this to beef up our advocacy, so that when we're talking about Medicaid expansion, for example, and we need to really show our support of that, we can do that kind of thing. Outreach and education to really, we go out to apartments and different places to share information. We have fairs, people come in, but you know, to do a lot more of that, and something maybe even do education through media, convening and coalition building. I think that's the strongest thing we do by holding our meetings and our summits, is we bring people together, and people are always invigorated by it afterwards. Research, I know even Andrea has said this, that she'd like to see us take part in more clinical trials, you know, really encourage, because Asian Americans are not, you know, they don't do clinical trials that much. They're always seeking people from our community, and to really educate people as to why that's important, and you know, to be sure they're getting into clinical trials that are good for them and everything like that, but participate more in that kind of research. Yeah, so it's going to take some funding, and also structurally, organizationally, we need to build out that and prioritizing it, making it, you know, higher kind of on the list of things to do.
Right. Thank you. So we only have 7 minutes left because I know you have a hard stop. Talk to us a little bit about yourself, the awards you've won. I mean,
Oh,
they're so modest. So I know they're all important, but maybe the most recent, the
the
Random
most
Act of
recent,
Kindness.
and it's a random acts of kindness. And I had honestly not heard of this group before. And so when they contacted me, I kind of looked them up and I saw somebody involved that I know. And he was probably very instrumental in getting my name in the hopper. But they are a nonprofit group, a couple that had started it. And once they pick a day in July, I believe, that they call a Random Acts of Kindness Day, and they do service projects, much like MLK Day. And they have they choose about 7 or 8 people to be recipients of this award. So I was among some great folks that were awarded this, and they have a event, and this was in the middle of COVID. Well, it was last summer, so COVID was maybe subsided a little bit at that time. So they felt safe having a in-person event at the hotel, and it was very nice. And they had, the mayor there. They had people there to give us our awards. So I was very honored because I had not heard of them, but this couple, because of their background and things that have happened to them, felt that this is something they wanted to dedicate themselves to.
Well,
And of course, Robert Woods Johnson. It's a great foundation. And they had given a grant to 7 or 8 different groups. And they, in turn, would identify people in their network. So one was AAPI, the Asian American Caucus, that group. One was the Hispanics, the African Americans, the young people, the elderly, and a couple of other groups. And so they were given this grant for 3 years to identify people in that network that was qualified, and they felt should receive the Robert Woods Johnson Health Equity Award, that they had done something in that area to help address health inequities. So I was really honored to get that, because this is a national award and there are a lot of great people. But my work with Hope Clinic, I think, was one of the keys to my being selected. And it was a great opportunity. And Robert Woods Johnson, 2 years after that, hosted the winners to come back to support the winner for that year and to come together and hear about their stories and all. So I had the chance to travel up to Princeton, where they are, and see them again there. And it was a great opportunity.
congratulations. I'm so
Thank you.
honored. That's wonderful. So thank you for your whole, I mean, you gave us so much information so that we can trace the history of Hope Clinic and the Asian American Health Alliance as well. So going forward, you've already indicated your interest in getting PACE off the ground and maybe having a more concrete manifestation of the coalition itself. We probably need to schedule another interview 10 years from now.
It's a date. It's a date. We'll do that.
Anything else you'd like to tell us about, whether it's about you or the Health Alliance or Coalition or Hope Clinic or anything else? And before we have a few more minutes before you have to sign off, like 3 minutes.
Well, you're so sweet. I think I've covered the high spots. I do want to thank you, Anne, and your family for all you've done to help Hope Clinic, and you see the vision as well, and helped us realize a lot of it. So we appreciate that. I don't know. I think the other thing that we'd like to do is to work with our young people. You and I started the conversation about that. And I think the coalition, if we can strengthen that and make it on a more regular basis, and like you say, staffing, I think would help a lot. We could outreach more and have a platform for our young people or people new to the area to really get more involved. I don't think we're capturing that as well as we should. And as you say, we should learn from history. If we can, your Houston Asian American Archives has been tremendous. I know that the Health Coalition, Asian American Health Coalition, we are dedicated to try to move things your way and hopefully provide a place for us. And then the Asian American Family Counseling Center, I need to get with Kim Sito and maybe we can begin to develop a place for all of their things, because that needs to be put somewhere as well. So thank you for that resource. Without it, we'd be sitting here in our closet with all this in our closets. But that would be another to do on my bucket list.
Great. We would love to have your materials. Just let us know.
That would be
We'll come and
great.
pick them up. Great.
Thank you. Thank you.
Great.
Well, thank you, Anne. It's always a
thank you,
pleasure
Regine.
talking to you.
Yeah, it's wonderful to learn of all the things you've done. And I think you may know Asia Society Texas Center is developing a set of curriculums for Asian studies for high school. The first story we featured providing our material was G Family.
Yes.
The second story would be Hope Clinic. And that's why
Oh.
these interviews will be very instrumental in their developing curriculum. So we may come back to you for some clarification
Absolutely.
and facts and dates.
And I need to connect your students or you with Lynn Wynn. She's prepared to talk to you.
Great.
And if you need to talk with Beverly again, that would be great, or Karen. So those are the other three partners in crime. Whenever you're ready.
We are ready, and I'll follow up with an email.
Okay, very good. Well,
Thank
we'll
you
talk
so
again
much.
with the other things.
Yes.
You have a great and have a good move. I hope it goes smoothly for you.
Too.
I hope everything's working in the new house.
Thank you so much. Thank you.
Okay.